All right, we are going to start with the eye exam today. The first part of the eye exam is assessing visual acuity. If we were assessing far visual acuity, we would stand our patient 20 feet away from the eye chart, have them cover one eye, and read the lowest line that they could. If they needed glasses to assess their far, we would go ahead and have them wear those glasses during this exam. We then have them cover the opposite eye and read the line furthest down that they could. For the purposes of this exam, we will just be assessing near visual acuity. When we assess near visual acuity, we want to have the patient wear glasses if they need them for reading and not if they do not. This is Steve. Steve, do you need to wear glasses for reading at all?
No.
Okay. So for near visual acuity, we're going to have our patient hold the eye chart about 14 inches away from his face. And can you cover one eye and read the line furthest down that you're able to?
It's 4, 2, 8, 7, 3, and 9.
Great, and that is 20/20 vision. I'm going to have you go ahead and cover your opposite eye, and again read the furthest down that you can.
Same one, 4, 2, 8, 7, 3, and 9.
Again, 20/20 vision. Great, thank you, Steve. All right, the next part of the exam is assessing visual fields by confrontation. So I'm going to go ahead and stand right in front of you, and I'm going to have you go ahead and cover up your right eye, and I'm going to cover up my left eye. Now, you're going to see a number. I'm going to either flash 1, 2, or 5 in front of the patient, and we're going to assess the 4 different quadrants of the visual field. So there is an upper nasal quadrant, a lower nasal quadrant, an upper temporal quadrant, and a lower temporal quadrant. I'll go ahead and flash a number, and I'm going to have you just repeat that number when you see it, okay? The whole time I want you to go ahead and stare right at the bridge of my nose here. All right.
That's 1, or 2.
Okay.
That's 1.
All right.
That's 2. And that's 5.
Great. And now we're just going to do the opposite eye, all right?
That's 1. That's 2. That's 5. And that's 2.
Okay. If you were to get any of those wrong, we would go ahead and repeat that visual field. Now we're going to start with our external exam. So we're going to start with just inspection. We're going to start at the eyebrows. We're looking at the hair distribution. Then we're looking at the periorbital region. We're looking for any edema and lesions. Next, we're looking at the eyelids. We're looking for symmetrical movement, for any fasciculations or tremors. We're looking at the lid level. It's normal for the lid level to go across the iris, but not cross over to the pupil. We're looking at the eyelashes and making sure that they come outward and that they curve out. We're looking around at the skin for any flakiness, swelling, or masses. And lastly, we're going to palpate the lids for any nodules. So I'm going to have you go ahead and close your eyes, and I'm going to just lightly palpate the eyelids. And you can open your eyes again. Now I'm looking at the lacrimal sac. I'm looking for any inflammation. In certain instances, I may actually palpate the lacrimal sac for tenderness, or I may actually push on the lacrimal sac upward and inward to look for any regurgitation. Next, we're going to look at the anterior eye. We're looking at the conjunctiva and the sclera. I'm going to have you go ahead and look upwards, and I'm going to depress your lids a little bit. And again, looking at the sclera. I'm looking specifically for any color changes or for discharge. We're looking at the cornea, looking for any corneal arcus, which is a white ring on the edge of the cornea, or pterygium, which is a white growth that can go on the sclera and the cornea. Specifically looking at the cornea for any opacities, and then moving on to the pupils. It can be helpful to use a card when looking at the pupils and estimating the size of the pupils. We're looking at the pupils to make sure that they're equal bilaterally, that they're round, and then we can go ahead and estimate the size. A difference of about 1/2 millimeter is normal. Anything more than that is abnormal. Next, we're going to go ahead and take our light. And Steve, you're going to have a light kind of shine right in your pupils. I'm going to have you just look straight ahead, okay? So I'm going to start by shining my light in Steve's left pupil, and I'm going to watch for it to constrict. And then I'm going to go ahead and shine it again, but this time I'm going to be focusing on his right eye and making sure that that right pupil constricts when I shine the light in the left. Then we're going to go ahead and switch sides and do the same thing, making sure that right pupil constricts, and now making sure the left pupil constricts. I'm going ahead and moving on to the iris. I'm looking for symmetry of the iris, for any scars in the iris. And then another test that can be done is to assess the depth of the anterior chamber of the eye. We do this by bringing the light from the temporal region and shining it towards the nasal region. So Steve, I'm going to have you look straight ahead again. And I'm going to go ahead and shine that light from the side, and the entirety of the iris should light up just like it is. We're going to go ahead and look at the other side and do the same thing. Good. If we were to see a crescent that wasn't lighting up, that may indicate an increase in intraocular pressure. The last thing that we may do at times if we're worried about high intraocular pressure is palpate the firmness of the eye itself. So I'm going to have you close your eyes again, and I'm going to just lightly palpate the firmness. And they feel soft bilaterally. We're going to move on to extraocular eye movements. So I'm going to stand in front of Steve here, and I'm going to move my finger in an H direction and ask him to follow my finger with just your eyes and not your head, okay? Mm-hmm. All right. So I'm looking for equal, smooth movement, making sure that there's no nystagmus. And that's great. All right. Now I'm going to check for convergence. So I'm going to ask you to look at the corner of the room there. And now my finger is out in front of you. Go ahead and focus on my finger. As he focuses on my finger, I'm looking to make sure that his eyes converge together and his pupils will slightly constrict at the same time. The last thing that we're going to do is look for the corneal light reflex. For this, we're going to go ahead and shine a light right on Steve's eyes, and we're going to see that bright reflex that comes back, and we're going to make sure that it's equal bilaterally, and it is. The last part of our eye exam today, we'll be using the ophthalmoscope. So just kind of showing you some features of the ophthalmoscope, and I'm going to use your gown to show that. Right on the handle here is an adjustment for how bright the light is, and you can see as I turn it, it goes from dim to bright, right on Steve's gown. There's another dial right up here, and that adjusts the focus of the ophthalmoscope. We're going to start with that dial on 0. This is your side of the ophthalmoscope, the side that you'll be using, and you'll be looking through this area right here. The opposite side of the ophthalmoscope has another dial that controls what kind of light comes through. So I'll just show you the different options here. There is a small, medium, and large circle. There's a target, a slit light, and a blue light. For the purposes of our exam, we're going to use the medium light at a medium intensity, and we're going to start at 0. So we are going to start with your right eye, Steve. So I'm going to just bring this cord behind you here. All right, so I am going to have Steve look straight ahead at the corner of the room, and I am going to hold the ophthalmoscope in my right hand when looking at his right eye. And then I'm going to take my left hand and put it up on his forehead so I know exactly where he is at all times. Then I'm going to go ahead and look through the scope and shine the light right on his pupil. And eventually you're going to see what's called a red reflex. You're going to follow that red reflex or that orangish color in. And about at this level, you're going to start to be able to pick out a blood vessel. At the point that you can see a discrete blood vessel, you may use this dial right here in order to get that blood vessel right in focus. So again, I'm going to follow it in, and then find that blood vessel, get it in focus, and follow in further. And as we follow it in further, I'm going to come over here. As we follow it in further, the blood vessels are like trees, and we want to follow the blood vessels towards the trunk of the tree, and that will lead us to the optic disc. We're going to go ahead and switch sides and do it
On the opposite side now. Again, starting at 0. I'm going to take off my glasses. It'll likely be easier for you if you take off your glasses. My hand on the forehead again, and I'm going to follow that red reflex in. Adjust if needed, and then follow to the optic disc. Doing okay?
Mm-hmm.
All right. So while we're doing that, we're looking for lens clarity, the red reflex, the retinal color for any lesions. At the vessels, we're again following the vessels to the disc and looking at the macula.